Hello. June is here and the warm weather is upon us. It was wonderful to be out this weekend for the Harrison Township weekend celebrations. It was also great to see the recognition of Pride Month as I went through town, the special understanding of the need, especially during this period of time of health equity, of understanding that we must provide equitable care to everyone. We have worked so hard to get this vaccine out to people, and it really is just so wonderful to see that 50% of New Jerseyans are now vaccinated. Now, we and our team are working very hard to find all different avenues to be able to accommodate. So we've gone to schools, we've gone to businesses, we've gone to farms, and we also are creating the opportunity to serve the homebound now. So please reach out to the Inspira team, look at our website, all the contact information is there. We're glad to try and figure out how best to get you your vaccine. It is so important that we hit that 70% herd immunity. We know that with that and with the vaccinated population, as we continue to struggle with this virus and whatever variants it comes, that certainly, while this is not a cure, it does minimize the impact on people, and we do want to make sure that we have everybody have access to the same technology and the same medicine that can indeed help us move forward. We also have seen that as part of this reopening, that 50% of Americans have had some type of hesitation. The American Psychological Association calls it Reentry Anxiety, where people are really struggling with fear. Absolutely fundamental fear of coming back to fully being open. And so we continue to remain ready to serve with our behavioral health services available, but also encourage people to make sure that if indeed you're feeling some of that stress, that you reach out. You know, it's funny, we've talked about this over and over again about the need for people to access behavioral health services. But I find as an employer that probably one of the hardest things is to try to think about how to talk to people who we see that are anxious and are exhibiting different behaviors. So I would encourage you to look for those signs in yourself and in others, because right now, as we go through these tumult times, it really is important for us to be present, both as colleagues as well as the employer. You know, one of the things that we've seen is our own staff who have been through COVID and have faced some challenges. One of our employees, Bev Lippincott, talked about her struggles. Even after she did the quarantine period, even after she was quote unquote better, she still didn't feel right. So we actually have created a program that we are addressing for what we call long haulers. These are people that are still struggling with COVID, even though the quarantine period is over. They test negative, they're still showing symptoms and signs. And so it's a combination of things. It's both physical therapy, respiratory therapy, occupational therapy that really has a whole rehab component to it that allows people to like Bev, to regain their strength and reentry. Now, I'm thrilled to tell you that Bev is back to work and doing great, but she needed that extra help. And so if indeed you've been through COVID and find yourself continuing not just to feel completely 100%, I encourage you to reach out to us and learn about our programs and make sure that we can provide those and make them available to you. I'm so proud of the team as they've continued to create the opportunities both to create new programs as well as take on new learnings. Our emergency medical services folks have taken on the challenge at the beginning of COVID to actually go for an additional certification. This certification allows us to make sure that we have all the tools necessary to have all the things that we need in the field. Now, COVID certainly tested us on that. And this certification is one more example of an accreditation that tells you that we've gone that extra mile. A huge shout out to Ken Bullwinkle, who led that effort for our EMS team, and to the EMS team members as well, who participated in that training and successfully completed it. Again, these are examples of all the things that Inspira does to make sure that we are meeting your needs. And what we need from you is to continue to keep these safety measures in practice that we've learned during COVID. That's washing your hands, making sure that when necessary, wearing your face mask, and of course remaining socially distanced. Even with some of the restrictions that have been lifted, it's still necessary for us to keep that social distance and make sure that we protect ourselves. Until we meet again, be well and stay safe.